I'm going to talk about the 10 causes of Down syndrome. Number 10, Trisomy 21. These are 3 types of Down syndrome, each with separate causes. Of Trisomy 21 is the most common of these. In Trisomy 21, a random error in cell division occurs. The error is called non-disjunction. Typically, each pair of chromosomes from the father or the mother separate at conception to provide one half of the embryo's pair of chromosomes in trisomy 21. One of the pairs of 21's 21st chromosomes does not separate. As a result, in the embryo, the 21st chromosome instead of 2, which is replaced throughout development. This is the most common cause of Down syndrome. Next, it's inherited. Hereditary is not a factor in most instances of Down syndrome, but small percentage of cases are linked to parents who are carriers of a specific type of chromosome. This chromosome is called a translocated chromosome and causes one of the less common types of Down syndrome. Although this is a rare, genetic counseling can still help determine if this occurs. May apply to your research has not yet determined exactly why these cells division errors happen, so you should talk to your doctor if you are worried. Number 10. Number 9. Age at time of pregnancy. Only one proven cause of increased risk of Down syndrome is maternal age. Some research believe this is because a woman has a finite supply of eggs. As a woman ages, so do the eggs. They may deteriorate over time. Scientists predict the rates of Down syndrome is likely to increase the next several years as more and more women wait until late in life to have children. Although some instances of Down syndrome are caused by the father, the age of the father is not a factor in likelihood of the condition. Another factor is other children with Down syndrome. For parents who have one child with Down syndrome, chance of having another child with the condition increases dramatically. These increase in likelihood is even greater in the cause of Down syndrome in your first child with trisomy 21. However, the risk does go down for cases in which the cell division error happened on the paternal side. If the error due to improper cell division in the egg, it's more likely to be repetitive in the future pregnancies. An OB/GYN or genetic counseling specialist will be able to help you decide if the probability of having another child with Down syndrome is more likely in your specific case. Number 8. Mosaic Trisomy 21. Another cause of Down syndrome is Mosaicism. This rarest type of Down syndrome and affects only a small fraction of pregnancy. It's also typical results in less severe symptoms, such as fewer physical characteristics of the condition. In mosaicism, only some of the embryo cells contain an extra 21st chromosome. The only cells contain the traditional 46 chromosomes. Mosaic Trisomy 21 is never inherited, but it's thought to be random genetic error. Mosaicism also does not typically run in families, so if one of your children have mosaic Down syndrome, future pregnancies are unlikely to be affected. Number 7. Positive risk tests. While risk tests are not a cause of Down syndrome, you can determine if your pregnancy is at a higher risk of participating in genetic counseling and taking a risk test. There's several tests available, random from blood tests and sonograms to chronic villus samplings and amniocentesis. Typical women are given one of less invasive tests first. These blood tests give a considerable amount of false positive, so women who test positive are encouraged to follow up with a more accurate diagnosis exam, such as CVS. Some parents choose to complete these tests, while others prefer to wait until after birth to find out. A parent with Down syndrome. Patients who have Down syndrome are typically capable of having emotional attachment relationships. This can help them develop some cognitive skills. People with Down syndrome are also usually capable of having romantic and sexual relationships, and most have normally functioning reproductive systems. One risk, however, is a woman with Down syndrome who gets pregnant are much higher risk of giving birth to children who also have the condition. Down syndrome is passed from mother to child directly more to 30% of the time. Some research even suggests that it may be passed on nearly 50% of the time. Men, however, are likely to be infertile, so the risk of them passing it on is very low. The next cause, number 6. Translocation Trisomy 21. Translocation is another type of Down syndrome, although it's not nearly as common cause as standard Trisomy 21. When translocation Trisomy 21 occurs, there are still only 46 chromosomes in the cells, just as there would be in a person without Down syndrome. However, a copy of all part of the 21st chromosome will attach itself to another chromosome within the cell, which causes Down syndrome traits and translocations like trisomy 21. Translocations can be inherited or random. Patients usually have all the physical and cognitive symptoms of Down syndrome when it's caused by this genetic complication. Number 8. Number 5. Research has shown there is no environmental or behavioral causes that rootly lead to Down syndrome. Many parents are surprised by a Down syndrome diagnosis for their child, which can sometimes cause feeling of guilt, confusion, and whether the condition has been prevented. However, external factors like drinking alcohol, smoking, being exposed to toxins, or usually occur on conception. This means the decision making during pregnancy don't play a role in its occurrence. However, external factors do affect the area of developing during pregnancy, so parents should still be cautious. Number 4. Random chance. So far, researchers have not been able to determine exactly what causes Down syndrome. That leaves chance as probable culprit. Down syndrome affects children born to parents of all ages, race, and socio-economic classes. This is no way completely rule out possibility that you will have a child with Down syndrome, although there are certain factors such as maternal age that increase the likelihood. However, there are plenty of older women who give birth perfectly healthy children as well. Genetic counseling and testing before or during pregnancy that can help you learn more about your chances. Number 2. Down syndrome is genetic chromosome disorder. It's caused when abnormality cell division results in extramaternal for chromosome 21. Individuals with Down syndrome develop distinct mental and physical features. Many suffer from learning delays and disabilities, as well as developmental problems that affect the bones and muscles. The disorders are more prone to developing other medical conditions such as heart problems. Keep reading to learn about the symptoms of Down syndrome.